The following special treatment guidelines apply to treatment with manual lymph drainage and differ from the principles of classic massage. Your therapist will tell you how much pressure to use, but you generally use enough pressure to stretch the skin and avoid sliding the fingers on your skin. Repeat the strokes 15 times, one stroke every 2 seconds. You should not feel any pain during the manual lymph drainage. There should be no reddening of the skin. Do not use lubricants such as lotions or oils. You will need a long-handled bath sponge for this activity. 1. Neck. Perform this on the affected side first, and then the unaffected side. Place your index finger and the middle finger of the opposite hand together, and then position them in the hollow space close to your neck. Stretch the skin forward and curve your fingers inward to the middle of the neck and release the pressure. Repeat 15 times. You may do this together or one side at a time. 2. Armpit. Place your affected hand in the unaffected armpit. Stretch the skin forward and curve your hand upward toward the neck area. Release the pressure and repeat 15 times. 3. Unaffected chest. Perform this on the unaffected side only. Place the palm of the affected hand on the chest, just below the collarbone on the unaffected side. Stretch the skin laterally toward the unaffected armpit and release the pressure. Stroke laterally 5 times in 3 lines across the whole chest. 4. Affected chest. Perform this on the affected side only. Place the palm of the unaffected hand just below the collarbone on the lateral side of the affected chest. Stretch the skin medially toward the unaffected armpit and release the pressure. Stroke medially 5 times in 3 lines across the whole chest. Five. Deep breathing. Place hands on either side of the lower ribcage area. Take a deep breath, letting your belly and lower ribs expand. Hold the breath for 1 to 2 seconds. Breathe out, pressing your hands up and in to help expel the air. Repeat 3 to 5 times only. Perform all of the next techniques only on the affected side. 6. Groin. Place your hand in the affected groin area. Scoop the hand in an upward direction. Repeat 15 times. 7. Lower abdomen or tummy. Place your hand at your waist close to your navel. Stretch the skin toward the groin area and release the pressure. Stroke downward 5 times in 3 lines. Eight. Trunk. Place your hand on the chest wall just below the breast or scar on the affected side. Stretch the skin downward toward the groin area and release the pressure. Stroke downward 5 times in 3 lines. Nine. Shoulder. Place the palm of your unaffected hand over the affected upper arm, just below the top of the shoulder. Stretch the skin up over the shoulder toward the neck area. Stroke upward 5 times in 3 sets. (10) Upper arm outside. Place the palm of your unaffected hand over the outer part of the affected elbow. Stretch the skin up toward the shoulder and release the pressure. Stroke 5 times in 3 sets. (11) Upper arm inside. Place the palm of your unaffected hand over the inner part of the upper arm by the elbow. Stretch the skin outward and upward towards the shoulder and release the pressure. Stroke 5 times in 3 lines. (12) Back of the forearm. Position your affected forearm with the palm facing away from you. Place the palm of your unaffected hand on top of the wrist. Stretch the skin up towards the elbow. Stroke 5 times in 3 sets. (13) Front of the forearm. Position your affected forearm with the palm facing toward you. Place the palm of your unaffected hand at the wrist. Stretch the skin up towards the elbow. Stroke 5 times in 3 sets. (14) Top of the hand. Position your affected hand with the palm facing away from you. Place the palm of your unaffected hand on top of the affected hand. Stretch the skin up towards the wrist. Repeat 15 times. (15) Palm. Position your affected hand with the palm facing toward you. Place the palm of your unaffected hand in the palm of the affected hand. Stretch the skin up towards the wrist. Repeat 15 times. (16) Fingers. Stroke down each individual finger toward the web spaces. Begin at the fingernail area and continue toward the web spaces. Repeat 15 times for each finger. Repeat everything in reverse order from 15, 14, 13 down to 1. Back. Using a long-handled bath sponge, stretch the skin along the back of the affected shoulder toward the neck area. Repeat 15 times. Stretch the skin along the back from the affected shoulder over to the other shoulder area. Repeat 15 times. Stretch the skin along the back from the affected shoulder down below the waist. Repeat 15 times. If you have any questions, please contact your therapist.